This is the Coronavirus Morning Report for Friday, April 24th, 2020. I'm Jackson Bird. The woman assumed to be the first coronavirus death in the U.S. presents a puzzling case. Breaking down the big antibody test in New York, did 1/5 of New Yorkers already get infected? And if so, what does that mean? States are building out their own brigades of test and tracing workers. The lockdown means immunizations for other diseases are dropping dangerously. And the story of the last movie theater showing first-run movies in the U.S. Just quoting this from the Washington Post right off the top. President Trump is facing widespread backlash after musing during a White House briefing that disinfectants could be injected into coronavirus patients' bodies to kill the virus. Medical professionals and makers of household cleaning products responded by urging people not to inject or ingest disinfectants, which are highly toxic. End quote. Listen, you know we try hard on this show to remain apolitical, but I think we can safely say that ingesting or injecting disinfectants is not a good idea. I think we can all agree on that, I hope. The Czech Republic is lifting the nation's restrictions on travel and movement. The Czechs were among the first to enact a strict nationwide lockdown and have maintained a comparatively low number of cases, and in fact reported the lowest increase in positive test results in a month yesterday with just 55 new cases, bringing the total number to 7,188. We continue to watch the worrying situation in Japan. Tokyo alone reported 134 new cases on Thursday. The official total is 3,573 infections in the Japanese capital, but testing levels remain surprisingly low. Just 167 people were tested citywide on Monday, the latest day for which testing numbers are available. Again, if your testing rate is low, but your positive case numbers are surging, that likely means you're only catching the tip of the iceberg. And a Colorado meatpacking plant that has been closed for 2 weeks will reopen today. The JBS USA facility in Greeley, Colorado, has been shuttered since April 11th after more than 100 of the plant's 6,000 employees tested positive for coronavirus and 4 died. Restaurants in Georgia are slated to reopen today, quite controversially. So without treating this flippantly, we are about to see the first test regarding how willing people actually are to return to normal life, even if restrictions are limited. This is something Brian has mentioned on his tech podcast. Reopening the economy might not be like flipping a light switch back on. Even when you reopen the doors, there's no guarantee people will feel safe enough to re-enter them. This is quoting the Washington Post about the Georgia reopening. Some restaurateurs say even if they did reopen, they could still lose money, with patrons still fearful and distancing orders sure to slice into their potential revenue. Eater Atlanta posted a list of dozens of restaurants that have announced they have no plans to swiftly change course. We'll get to that point, one restaurant owner said of reopening, but there are a lot of people out there who are still terrified. End quote. And you might recall how earlier in the week autopsies were being performed on people in California, revealing that the first coronavirus deaths happened there about a month earlier than officials had assumed. Well, the San Jose Mercy tracked down the identity of the first assumed death, and this is quoting the Washington Post. By all accounts, Patricia Dowd lived a healthy lifestyle. The 57-year-old in San Jose ate well and exercised. She had no heart issues and strong lungs, and she had not left the country since November. So when Dowd died on February 6th, family members asked for an autopsy to examine the cause of her death, according to the San Jose Mercury News. Now, friends and family members are retracing the final days of the woman they knew best for her long-lasting friendships and loud, contagious laugh. A senior manager at Lam Research Corp., a semiconductor company in Fremont, California, said Dowd appeared healthy just a few weeks before her death. She had traveled to Beijing in November and to Oregon in January, but no one seems to know where she may have contracted the virus. On February 1st, she and her brother, Ricardo Cabello, were supposed to drive together to the funeral of a high school friend. With flu-like symptoms, she backed out at the last minute. "I just realized today that she saved my life," Cabello told the Mercury News. "She called me that morning and told me she couldn't go. She wasn't feeling well." By February 6th, she was working from home, exchanging messages with a coworker at about 8 a.m., the newspaper reported. About 2 hours later, her daughter found her dead. End quote. At the risk of saying this again, huge news. An antibody study in New York came out yesterday, and 13.9% of those tested positive for COVID-19 antibodies, suggesting 13.9% of New York's population has gotten the disease. The antibody test rate varied wildly across the state and was mostly concentrated in and around New York City. In the city itself, 21.2% of tests came back positive. On Long Island, 16.7%. And in Westchester County, the location of the state's first hotspot, 11.7% returned positive. The rest of the state had 3.6% positive test results. So that's how you get the weighted 13.9% positive number statewide. But ready to play the speculation and caveat game? If this test was representative of the entire state of New York, that would suggest 2.7 million New Yorkers have or have had the disease. Cuomo said, quote, "What we found so far is that the statewide number is 13.9% tested positive for having the antibodies. They were infected 3 weeks ago, 4 weeks ago, 5 weeks ago, 6 weeks ago, but they had the virus, they developed the antibodies, and they are now recovered." Quoting from CNBC, "While COVID-19 deaths across the state have begun to level off, the numbers of lives lost is still breathtakingly tragic," Cuomo said. The state's mortality rate remains persistently high at 7.4%, with at least 19,453 fatalities and 263,754 confirmed cases, according to data compiled by Johns Hopkins University. The antibody testing, Cuomo said, indicates that the actual death rate is far lower, less than 1%, he said, end quote. To be more specific, and using New York City numbers as a sort of lowest possible bound, because New York City has suffered the most number of cases, along with also experiencing the highest rate of testing, that would end up suggesting an infection fatality rate of 0.76%. But ready for the caveats? First of all, no word initially on what type of tests were used, or any data on accuracy. If you'll recall, we had those 2 antibody studies in California that later came in for criticism. Investigators in Santa Clara County estimated that the prevalence of antibodies was between 2.5 and around 4%, while another study in Los Angeles County estimated that between 2.8 and 5.6% of the population carried coronavirus antibodies. But the California studies were criticized for not sufficiently taking testing error into account and selecting subjects not representative of the larger population, thus perhaps getting artificially high results. The testing results here in New York also may be artificially high because, quote, "these are people who were out and about shopping," Cuomo added. They were not people who were in their home. They were not people isolated. They were not people who were quarantined, who you could argue probably had a lower rate of infection because they wouldn't come out of the house. End quote. Also, no one under the age of 18 was tested. So basically, this test suggests that the virus here in New York might be way more prevalent in the community than we thought, but does this represent the broad community? For example, what would the positive rate be among people who have basically stayed inside for the last 4 weeks? On the one hand, this would be amazing news if the disease was not as deadly as feared, and that for a large proportion of people the symptoms were so mild as to be almost non-existent. That would mean all the hospitalizations and deaths we've seen thus far have been from the unlucky proportion of the most severe cases. But on the other hand, that would also suggest, again, that we remain a long way away from herd immunity, i.e., we would have a long way to go before the disease works its way through the entire general population. For example, let's say these people who got tested represent 1/3 of the population. 1/3 of the population that is still out and about and at least somewhat circulating in public. That would mean that fully 6/7 of them still could face infection. And let's further say that 2/3 of the rest of the population, which again, by nature of where this testing took place, does not include them, has been staying indoors and thus hasn't had the infection opportunities that this population has had. That would mean 80 to 90% of the population could still face infection. And those infections could still include severe cases requiring hospitalization and leading to deaths at the same rate we've already seen. So it's really a glass half empty / half full situation. If this data were to prove to be accurate, then number one, the disease would not be as deadly as feared, but number two, it would clearly still have a lot of infecting left to go. We'd still be in the early innings of this. Actually, we'd still be in the first innings of a 9-inning ball game. And that's leaving the biggest caveat of all for last. This is just one study. Very preliminary. Lots of other shoes that could drop here, including this one, quoting from the New York Times. I'm very ambivalent about these tests because we don't really know yet through the science what it means to have an antibody, said Dr. Joan Cangiarella, the vice chair of clinical operations at NYU Langone Health's pathology department. We're hoping these antibodies mean you will be immune for some time, she said, but I don't think the data is fully out there to understand if that means that you're actually immune. And if these antibodies start to decline, what's the time frame? Does it decline in a year from now? End quote. Keeping it local for a few more minutes, New York, New Jersey, and Connecticut are teaming up with Bloomberg Philanthropies to build out a regional contact tracing program that will complement the area's increasing testing capabilities. Governor Cuomo explained, quote, "You have to start with a large number of tests. We set out a goal yesterday to double the number of state tests to go from 20,000 on an average to 40,000. That is just about the maximum capacity for all of the laboratory machines in the state. Every positive, you have to go back and trace, and the tracing is a very big deal. Once you trace and you find more positives, then you isolate the positives. They're under quarantine. They can't go out. They can't infect anybody else." End quote. That will then be fed into what Cuomo calls the reopening calibration, in which the state would gradually reopen its economy as its ability to test, trace, and isolate positive cases increases. Washington State, site of an early coronavirus hotspot, is also planning a massive contact tracing effort, quoting NPR. Washington was the first state where public health departments used contact tracing to try to box in the coronavirus in January. That effort grew more intensive at the end of February with the first reports of COVID-19 deaths, but by mid-March, as the cases ballooned, the sheer numbers forced public health departments to abandon most contact tracing. Now that numbers of hospitalizations and new cases are dropping, Washington is preparing to restart rigorous contact tracing, but on a dramatic new scale. We expect roughly 1,500 workers focused solely on contact tracing by the second week of May, Governor Jay Inslee said. This workforce will be rapid response, something like a fire brigade. There are already about 700 contact tracers available, state and local public health employees. More will be hired, and Washington State Secretary of Health John Wiseman says that the state will also draw 500 from the National Guard. Even with reinforcements, the state expects contact tracers to be busy. Quote, "We estimate that each case investigator can interview in a day 7 cases, Wiseman says. And for each of those COVID-19 cases, they have to reach out to that person's contacts. Quote, "We think that generally, on average, an interviewer can reach out to 21 contacts a day. Washington considers a contact to be anyone with whom the infected person spent at least 10 minutes at a distance of less than 6 feet. Some of the contact searching will be streamlined with software, such as online contact questionnaires, but Wiseman says that's still a lot of work. Quote, "It is, in part, that human touch about developing a rapport so people will share that information," end quote. Indeed, this is the shoe, leather, hands-on work that Brian has talked about before, and it's probably the only way it can be done effectively. Earlier this week on this show, we discussed that people without COVID-19 who need other kinds of medical attention are staying away from the hospital out of fears of catching the virus, potentially creating a sub-epidemic of severe illness or even silent mortality. But what about those who do need urgent treatment? A new report says patients are having to wait much longer for organ transplants. Even organ donations are down by more than a third. Quoting from Stats, "From the transplant perspective, all transplants are considered emergencies. It's like trauma. There are patients that are listed we know are going to get sick and die if they don't get an organ," said Jorge Reyes, chief of transplant surgery at UW Medicine. Having said that, we may feel certain patients could wait. For people who need a transplant, their fate depends on the organ and how sick they are. Pancreas transplants are on hold indefinitely, classified as life-enhancing, not life-saving, because patients can survive on insulin. Kidney patients who can continue to function on dialysis have been taken off waiting lists while still accruing waiting time for the day when non-urgent transplants resume. Heart patients who are not already in the hospital on mechanical heart assist devices and who may be able to wait a few weeks will do so. Living donors also have to wait. It's ethically questionable to put a healthy person in added harm's way from possible exposure to the coronavirus in the hospital to donate a kidney or part of a liver. Prospective transplant recipients can't have COVID-19 either. The immune suppression drugs they must take to prevent organ rejection would prevent them from fighting off the virus and make them super shedders of the virus, placing those around them at hugely increased risk of being infected. Transplant emergencies mean people who can't wait another week or even another day. But these patients are also balancing on a knife's edge. They have to be sick enough to be near death, but well enough not to need long ICU stays in hospitals overwhelmed by coronavirus patients who need weeks on ventilators so they can breathe. Quote, "Our ability to do a liver transplant is not always just about the risk of COVID-19 exposure to the patient," said David Mulligan, chief of transplantation surgery and immunology at Yale. It's also, do we have a bed? Do we have a ventilator to take care of the patient? Can we isolate the patient from other COVID-infected patients? Do we have enough time to do this operation, get them through it, keep them away from COVID, and then get them out of the hospital safely? That's what we're shooting for." End quote. And another issue? Blood donation levels have massively dropped, making blood supplies essential for transplant surgery under increasing pressure. And then, of course, organs must themselves be tested for COVID-19 to ensure that a transplant recipient is not given the virus in the course of the operation. However, there is some light on the horizon. Transplants are beginning to resume in parts of the country hit earliest by the virus, like Washington state, as the number of COVID-19 cases declines and hospital resources are able to be reallocated.
BetterHelp is the therapy and counseling solution custom-made for this moment in time. You can start communicating with professional counselors in under 24 hours. Visit their website and read their testimonials that are posted daily. The service is available for clients worldwide and on call anytime you need it. You'll get timely and thoughtful responses, plus you can schedule weekly video or phone sessions so you won't ever have to sit in an uncomfortable waiting room, as with traditional therapy. BetterHelp is committed to facilitating great therapeutic matches, so they make it easy and free to change counselors if needed. It's more affordable than traditional offline counseling, and financial aid is even available. BetterHelp wants you to start living a happier life today. Do so by visiting betterhelp.com/report. That's BetterHelp, and join the over 800,000 people taking charge of their mental health with the help of an experienced professional. Special offer for Coronavirus Morning Report listeners: get 10% off your first month at betterhelp.com/report. I've been a Stamps.com customer for 20 years. I've founded 3 different startup companies, and every one of them used Stamps.com from day one. Some of those companies were literally built on top of the services Stamps.com allowed me to provide to customers. In the current business environment, you need Stamps.com just to keep your operations running at this point. Anything you can do at the post office, you can do at Stamps.com, and yet you don't actually have to go outside and physically go to the post office. Simply use your computer to print any U.S. postage 24/7 for any letter, any package, any class of mail, anywhere you want to send. And you save money with Stamps.com, something that's especially welcome to any business during these times. 5 cents off every first-class stamp and up to 40% off USPS shipping rates. And now, in addition to offering discounted U.S. Postal Service rates, Stamps.com also offers UPS services with discount rates there up to 62%. Right now, listeners to this show get a special offer that includes a 4-week trial plus free postage and a digital scale, all without any long-term commitments. Just go to Stamps.com, click on the microphone at the top of the homepage, and type in briefing for this special trial. That's Stamps.com, enter briefing. Stay safe, my friends.
Another consequence of people staying away from doctors' offices is that immunization rates for other diseases are dropping precipitously. Quoting from the New York Times, PCC, a pediatric electronic health records company, gathered vaccine information from 1,000 independent pediatricians nationwide. Using the week of February 16th as a pre-coronavirus baseline, PCC found that during the week of April 5th, the administration of measles, mumps, and rubella shots dropped by 50%. Diphtheria and whooping cough shots by 42%, and HPV vaccines by 73%. The doses that states distribute in a federally funded program for uninsured patients called Vaccines for Children have also dropped significantly since the beginning of March. The Massachusetts Health Department said its doses were down 68% in the first 2 weeks of April compared with the previous year. Minnesota reported that its doses of measles, mumps, and rubella vaccine dropped by 71% toward the end of March, end quote. The decline jeopardizes herd immunity, in which 90 to 95% of the population is covered by a vaccine, and means that millions of children could be at risk for developing life-threatening but preventable diseases. Dr. Sean T. O'Leary, a member of the American Academy of Pediatrics Committee on Infectious Diseases, told The Times, "The last thing we want as the collateral damage of COVID-19 are outbreaks of vaccine-preventable diseases, which we will almost certainly see if there continues to be a drop in vaccine uptake," end quote. Parents are faced with the challenge of balancing advice to only go to doctors' offices when absolutely necessary in order to minimize the risk of COVID-19 infection, with guidance from the CDC, the American Academy of Pediatrics, and the American Academy of Family Physicians, all of which recommend that vaccination schedules should be maintained as much as possible. Some practices have set up drive-through vaccination systems whereby patients can drive up, roll down a window, and a medical practitioner, fully masked and gowned, is able to give the needed vaccine injection into a child's arm. One positive change to come out of the COVID-19 situation, though, quoting from The Times, several doctors remarked on a noticeable positive shift in attitude toward immunizations after years of a vocal anti-vaccine movement raising questions in parents' minds. If anything, I've noticed a change in families becoming more interested in vaccines, said Dr. Elizabeth Mead, who practices in Washington, which has large pockets of vaccine-hesitant families. They're recognizing how devastating infectious diseases can be, end quote. Ending on a bit of a light note today, the entire weekend box office report from last week came from one drive-in movie theater in Ocala, Florida. With almost every other movie theater in the country closed, the Ocala Drive-In appears to be the only one showing first runs of new releases. Of course, since almost every new movie release has either been postponed or gone digital, the only two new releases last weekend were a couple of indie flicks, a World War II movie called Resistance and a horror film called Swallow. Though if you were to stop by the Ocala Drive-In, you could also be one of the few people in the nation to see Trolls World Tour on the big screen. Owner John Watsky says that they've taken precautions for social distancing. Every other parking space is roped off and concessions are delivery only by a masked, temperature-checked employee. But he says he won't close the drive-in, which opened in 1948, until he, quote, has no choice. In the 9 years Watsky's been the owner, he's only closed once, when he lost power after Hurricane Irma in 2017. There are 12 other drive-in theaters currently operating in the U.S., and a few more have plans to reopen, but none of them are currently showing new releases, like Ocala is. A lot of drive-in theaters are also repurposing their sites for other events. Several churches around the nation, including one in Donley County, the Texas town we reported on yesterday, are holding services at movie theater drive-ins, with honking encouraged in place of amens. And the Starlight Drive-In in Ohio will host their local high school's graduation ceremonies. There's also a number of restaurants across the country that have been repurposing their parking lots into drive-in theaters and screening classics while serving food in an attempt to keep the business going. Though, at least in one city, the operation was shut down because even with social distancing measures in place, it violated the state's stay-at-home orders. Drive-ins as a way to have fun while staying safe from illness is not a new concept. During their heyday in the first half of the 1900s, drive-in theaters ran ads promoting themselves as a way to keep your kids safe from local epidemics and be, quote, flu and polio protected. I'm not gonna lie, if I had a car, and if there were anywhere in New York City that actually had enough space for a drive-in, I would be all over this. A resurgence of the drive-in movie theater for the long term is not something I'd be mad about at all. That, honestly, is probably a great idea for the health and well-being of our communities going forward. That is all for today. As always, this show was produced by Ride Home Media. If you're keeping an eye on the news this weekend, why not go to our Facebook page, facebook.com/coronavirus morning report, and share some of what you're seeing. Maybe we'll add it to the show next week. We also post new episodes of the show there every day, so you can comment and discuss with other people. Or if Reddit is more your thing, we also have a subreddit where you can pitch us stories. That is reddit.com/r/coronaviruspod. And again, the Facebook is facebook.com/coronavirus morning report. Links to both of those in the show notes. Talk to you all on Monday. Be well.